Do you know what stage of Hashimoto's you're in? If you don't, this is a quick video to show you where you fall on that autoimmune spectrum, and then also to give you a better idea of the level of intervention that is going to be needed in order to help you achieve your Hashimoto's goals. So this is the stages of Hashimoto's. You can see where you are on this autoimmune spectrum. Starting with stage 1, this is the early stage, also called silent autoimmunity. Now, it's called silent because the only thing that is positive or elevated at this time are your thyroid antibodies. The rest of your thyroid hormones are going to look normal. You're not going to have any symptoms or any tissue destruction. And a lot of people get missed in this stage because most doctors are not screening for these thyroid antibodies. Although I think it is very important. I think it should just be part of standard care in your annual exams or your annual labs to just throw them in. They are cheap, they are diagnostic, and you can catch it at this early stage, especially if you have a family history of thyroid disease or a family history of autoimmune disease. Then you want to be screening for these thyroid antibodies so you can catch it at this time. Going from stage 1 to stage 2, that can take months or years, or you may never get to stage 2. You just stay in stage 1 forever. But if you do transition into stage 2, that is also called autoimmune reactivity. This is where subclinical hypothyroidism shows up, and it's also called early Hashimoto's. So you still have positive thyroid antibodies and they could be increasing. You also now have general symptoms. You have symptoms like fatigue, bloating, weight gain, and now your TSH could look normal, but it could also be slightly elevated or elevated, but the rest of your thyroid labs look normal. You also have more general symptoms, and you could possibly have tissue destruction. Now, some people do get diagnosed in this stage. I was one of those people. Most people just get missed during this stage because they're, again, not screening for these thyroid antibodies. General symptoms can be blamed on work or life or just getting older. And again, this stage also gets missed. You could also stay in stage 2 forever. But if you do transition into stage 3, this could also take months or years. And stage 3 is the more advanced stage. This is when you're diagnosed with Hashimoto's thyroiditis, hypothyroidism. So again, you still have those positive thyroid antibodies and they could have increased even more. Now your TSH is elevated, it is lab high, and there's abnormal T4 and possibly T3 as well. You have measurable symptoms, so now you have not only the weight gain and the fatigue, but maybe you have more symptoms like cold hands, cold feet, your hair is thinning, you have really bad constipation, and this is where most people are diagnosed. Most patients are diagnosed at this stage with either hypothyroidism, Hashimoto's thyroiditis, or both. And there's also measurable tissue destruction. And during this stage, you may also experience something called hashitoxicosis. This is a temporary hypothyroid stage, and that is caused by the sudden release of thyroid hormones into your system by the damaged thyroid cells. So when I say measurable tissue destruction, that is what I'm talking about. I'm talking about the thyroid tissue. Stage 3 is usually the first stage where conventional medicine will start offering treatment that includes thyroid hormone medication. Usually in stage 1 and stage 2, they don't have anything to offer for treatment or for intervention. But you already know that thyroid hormone medication is not the solution to Hashimoto's because it is not addressing that root cause that is really driving a lot of the symptoms and inflammation, which is your immune system. It's only addressing the deficiency that is caused by the Hashimoto's, which is a thyroid hormone deficiency. Conventional medicine can also offer more advanced treatments like biologics or thyroid removal, but again, it's not addressing what's really driving that autoimmune process. Stage 3 is also concerning because this is where you can start noticing other autoimmune diseases develop because of the level of immune dysfunction that is going on here and the inflammation. But it can really occur in any of the other stages too, but it's most likely to occur in stage 3. So now if you're like, dang, Dr. Nicole, well, what do I actually do then? Because I don't want to keep progressing on this autoimmune spectrum. I don't want things to get worse. I want to keep my thyroid function and I don't want to keep taking more and more thyroid medication. Well, good news for you is that I created a whole program that works at every stage and helps you really target those triggers and the root causes that really led to the development of Hashimoto's in the first place and led to you either gaining weight, the bloating, the brain fog, the fatigue, all of that because you're addressing it at the root cause. Because you're addressing it at the appropriate level, that will then lead to results. Now remember, Hashimoto's is a progressive, lifelong autoimmune disease, so there will be adjustments and ongoing maintenance in order to help you maintain results. Now in my program, we tackle 3 main categories of triggers. That includes nutrition, lifestyle, and environment. and I found the majority of Hashimoto's triggers live within these 3 categories, which is why it's the first place that we start. Once I've identified what your main triggers are, then I can go ahead and really create a plan that targets those triggers so that we can calm immune dysfunction, calm the chronic inflammation, and start repairing the damage that is done so you can finally start feeling better. If that's something you're interested in, then check out my free masterclass in my bio. I break down how I work with clients in my program in order to help them achieve these kind of results.